Hey, it's Dr. Birchler. This is a little discussion of ice versus heat when you're having, back pain, sciatica, radiating leg pain, of which we see a lot of. And the general rule here is you want to use ice, not heat. Certainly, if you're having radiating, leg symptoms, numbness, tingling, pain, burning, hypersensitivity, that kind of thing. People use different words for that, so we could use doctory words or just say it like we commonly say it. So a couple points to understand here. One is you can have symptoms in the legs or feet, and the problem is not in the legs or the feet. It's in the lower back where, say, the discs are. Similar phenomenon can happen where somebody's having pain in their arms, but they're having a disc problem in their neck. So we want to actually ice the lower back for these sciatica issues. And if it's more arm symptoms, we want to ice the lower neck. That's where the actual problem is that's causing the symptom. One reason I think that people often put heat on the area is when they're in pain. The muscles feel tight. They may have muscle spasm, and they think there's a tight muscle, and the muscles feel tight, so they're trying to loosen up. It is not a muscle problem. There's nothing wrong with the muscle. The muscle is reacting to disc injury, to pressure on a nerve, and it's trying to do something kind of protective or stabilizing to the spine. There's nothing wrong with the muscle. It's not a tight muscle. It is kind of a protective instinct. So it doesn't really solve anything. Couple points to understand here. This is looking at this is like a model of a low back disc herniation. So in the spine, you have the vertebrae, and you have the disc between. You have the nerves come out behind the disc. So this shows kind of like the disc, kind of looking at it that way. And this red stuff would be kind of like the jelly in the donut. It should all be in here. And if it herniates out, there's a nerve that comes out right behind here. And hence you can get sciatica, true sciatica nerve pain. Couple things to understand. This is living tissue. The disc is a ligament. It's a fibrocartilaginous ligament. So if you sprain your ankle, ligament. If you tear a meniscus in your knee, ligament, also kind of a fibrocartilage ligament. You don't want to put heat on those. It'll swell. It's going to hurt like crazy. It'll make increased pressure in the joint space. So we don't want to heat the lower back. It's going to increase this kind of, it's like when you boil water, when you add heat to something, there's more energy to it and more pressure to it. We don't want to do that in the low back. Part of the problem is heat tends to feel nice when it's on there, and it doesn't necessarily hurt while it's on there. 30 minutes later, hour or two later, you try to go to bed and you're throbbing, aching, radiating pain. You might not connect the two because there's a time lag. But just understand the general principle. This is a ligament injury, and there is true cellular inflammation, which is the body's natural response. That's what it has to do. That must be done to repair it. So we don't want to. We just kind of want to facilitate, blood flow to the area so the body can do its thing and repair it. But those are some of the dynamics of why adding heat to the area tends to increase radiating pain. Why we recommend ice to do that, and if you're having, say, radiating leg or arm pain that affects your sleep, which is pretty common when they're very bad, I generally recommend to, like fall asleep on a ice pack, and you can decide whether you want to have a directly on the skin or a layer or those kind of things. They'll start to warm up pretty quick, and you wake up, you just throw them on the floor or something if they're uncomfortable. But I've seen over the years that people can, they can fall asleep faster, maybe get a little bit longer sleep. And when you're struggling and can barely sleep, you'll take every bit you can get. And I've found that the ice can be like that. So that's a little bit more thorough understanding of the ice versus heat, and what to do, what not to do when you're having, radiating leg and arm pain.